a nerve plexus is the interweaving of the anterior rami of several spinal nerves. We have four main plexi that occur bilaterally. We have them in the cervical, brachial, lumbar, and sacral regions. We skip the thoracic region. And the individual rami can branch repeatedly. Remember, all of these are going to be the anterior or ventral rami. The dorsal rami do not participate in any of the plexus. Cervical plexus comes from the anterior rami of C1 through C4, and you do need to know that. The important part here is that C3, 4, and 5 are going to give rise to something called the phrenic nerve, and that's important because it innervates the diaphragm and allows you to breathe. So here's a picture of the cervical spine. You can see the cervical plexus here on one side, and it's this huge spaghetti mess of nerve endings. And that's okay. You don't need to memorize this. Just know that the cervical plexus comes from C1 to C4. And you can see right here we've got little branches of 3, 4, and a bit of 5 that go to make the phrenic nerve, which is then going to drop down through the middle of your thorax and go to the diaphragm. I want to talk about the implications of this for just a minute. Let's say we've got three cities, Boise, Meridian, and Nampa, and you have a highway system where you can connect the three cities. Now, if you go to Boise to Meridian, you can get off at Meridian and go somewhere else, and as long as all the roads are intact, everything's fine. But let's say you lose the highway between Meridian and Nampa. You can still go to Meridian and you can still get off on the exit at Meridian and back and go to Boise again. But now if you lose the information or the highway between Boise and Meridian, then you lose everything from that point down. So in this example, the brain is going to be Boise, and the cervical plexus is going to be Meridian, and the rest of the body is going to be Nampa. So if you break the spinal cord below the level of where the phrenic nerve kind of exits the spinal cord, then you can still send signals back and forth to the brain. But if you break or sever the spinal cord above that, then you're going to lose everything. Maybe you remember Christopher Reeve, played Superman from a movie back in the 70s. He was jumping a horse, fell, broke his neck, and severed it, I believe, around C4. So he did have a little bit of innervation to his diaphragm, but he lost most of it, and he had to be on a ventilator for a long time until they made him a diaphragmatic pacemaker that would shock his diaphragm and cause it to breathe. Literally had no control when he was breathing in or breathing out. The brachial plexus comes from the anterior rami of C5 through T1. It's another big spaghetti mess of nerves that are coming from kind of the middle and lower part of the neck, and they're going to go to your arm. The brachial plexus is divided into the rami, and then trunks, divisions, and cords. We have three trunks. There's a superior trunk, a middle trunk, and an inferior trunk, and then the trunks divide into anterior and posterior divisions. Finally, we have a posterior, a medial, and a lateral cord. Eventually, we're going to get to 5 nerves that are going through the arm that you do need to know. There's the axillary, the median, the musculocutaneous, the radial, and the ulnar nerve. Here's the brachial plexus. Again, you don't need to memorize this or draw it out, but you do need to know that it comes from C5 through T1, and we're finally going to end up with the musculocutaneous, the median, the axillary, the radian, and the ulnar nerve. Here you can see that the brachial plexus comes out of the neck. It's going to go through the axilla and then down the arm to your hand. Any damage to the spinal cord above C5 is going to result in paralysis of the arms. Any damage below there will leave the arms intact. The lumbar plexus comes from the anterior rami of L1 to L4, and it's going to give rise to the femoral and obturator nerves. And these are mostly going to do muscle and sensation for the upper part of the leg and hip and some of the abdomen. Here's our lumbar plexus, another big spaghetti mess. And then finally, we're going to hit the sacral plexus, which is the anterior rami of L4 to S4. You'll notice that L4 participates in both the lumbar and the sacral plexus. The important part of the sacral plexus is going to be the sciatic nerve, which is the longest and largest nerve in the entire body. And it's divided into the tibial division and the common fibular division. You can see here is a cross-section of the sciatic nerve. It's really, really really shockingly big when you see it in person. And that's because when we look at the spinal cord itself, there really isn't any perineurium or epineurium because we've got the meninges to help protect it. But as the nerves leave the protection of the bony spinal column, we need to protect them with connective tissue. And we start to put on lots and lots of epineurium and perineurium. And so when you look at a nerve in a gross dissection, most of the thickness of the nerve is actually going to be protective connective tissue rather than axons. Sciatic nerve goes anterior to the sacrum, down through what we call the sciatic notch, and then it's going to go down the posterior part of the leg. Sciatica is pain or injury to the sciatic nerve, and it's characterized by pain down the posterior leg and thigh.